Hello, so I'm Dr. Malescu, and I'm going to be going over the basics of anatomy, whether you're taking anatomy in college for a medical assistant program or nursing program, or if you're pre-med, or even if you're in the kinesiology and sports sciences, whether you're becoming a physical therapist, a PTA, or a yoga teacher, a Pilates instructor. Everyone needs to know the basics of anatomy. So I'm going to start with literally chapter 1 at the beginning of anatomy, AMP 1, and go over the language of anatomy, the anatomical positions, the anatomical planes, and the movements according to these planes three-dimensionally, as you know. All right, so let's get started. Without further ado, in yoga, we call this pose Tadasana, but in anatomy, it's called anatomical position. So anatomical position is where you're standing upright, your palms are facing forward, your thumbs are facing out, and your pinky is closest to your hips. Now, what I want to show you is that the midline of the body is going to define what's medial and lateral. So that midline of the body is one of the anatomical planes. The first plane that we're going to go over is the sagittal plane, and the mid-sagittal plane is more specific because it cuts the body in an equal left and right half. So if I annotate here with my pen, and hopefully I've had a lot of coffee, this is the mid-sagittal. Okay, so that is the mid-sagittal. So as such, your pinky, all right, is closest to this mid-sagittal plane. So in terms of description of what's medial and what's lateral, the pinky or the fifth digit is closest to this mid-sagittal plane or sagittal plane, and therefore it is medial. This thumb, all right, also otherwise known in anatomical terminology as the pollicis, and the hallux is the big toe. The hallux and the pollex are anatomically similar with only a proximal and distal phalanx, no middle phalanx. So those are the similarities, just a side note. I tend to jump back and forth, but I'm trying to put it all together as you're studying. So look at this thumb. This thumb is further away from this sagittal plane than the pinky. So therefore, the thumb is lateral to the pinky, and the pinky is medial to the thumb. But the pinky is lateral to the femur, which is this largest bone here of the skeletal system. So therefore, the femur is medial to the fifth digit and the fifth or phalanges, right? But the fifth finger is going to be, in reference to the femur, it's going to be lateral, according to the orientation of this mid-sagittal plane. Now, another thing that you should know about this mid-sagittal plane, let me move this up to here, is that everything that you do in this plane is sagittal plane movement. Okay, so if I'm bending forward, that's sagittal plane movement. So here is my mid-sagittal plane. If I'm nodding my head yes and no, okay, yes and no is sagittal plane movement, right? So this movement downwards, chin to the chest, is flexion. Moving the head back to neutral, all right, is extension. And then moving the head back, as you can see, if I go in profile, if I move my head all the way back, that's hyperextension. And what is the reference point? The mid-sagittal plane. So therefore, as you can see, the definition of sagittal plane is an equal right and left half. And we had forward and backward movement, which is known as flexion, meaning forward, and then extension back to the original position, and then hyperextension is bringing the head way back. So we can experiment on that later if I not share this page and I just show my full body doing a forward bend, reaching my toes. That's full flexion, then full extension back into mountain pose, Tadasana, or anatomical position, which is hands supine, palms facing forward, thumbs out, pinky towards the femur, right? Anatomical position. If you're in the yoga teacher training, it's called Tadasana or mountain pose, okay? If you're in my anatomy class in college, this is anatomical position, palms are facing forward. How do I know that the hands are supinated? This is my little trick. Soup's up, drop the soup. This is pronation. Hold the soup, the bowl of soup. That's supination. Hands are supinated. All right, so palms facing forward, hands are supinated. Okie dokie. So now that we went over sagittal plane movement, flexion, extension, hyperextension, and that mid-sagittal plane is an equal division of the right and left half of the body. We now move to coronal or frontal plane. Now, let me clear out the annotation so we could start over. And now we are going to talk about frontal and coronal plane movement. So if we divide the body in frontal and coronal plane movement, this is what we have. We divide the body in a front and back. So if I was in profile, so this was mid-sagittal. If I go in profile, I divide my body in a front half so that the front is my face, right? And the back is the back of my cheeks, ears, and the back of my head, all right? So this is the frontal section, all right? So if you cut the body into a front and the back half. Now we have two names for this. When we say frontal section, everything anterior is in the front and everything behind this frontal section, all right, is going to be posterior. So another synonym is also ventral and dorsal, because if you're a fish, you have the dorsal fin. So that's how I remember it. Ventral or anterior, posterior or dorsal. So anterior, posterior, or ventral, dorsal. And so the frontal plane is going to be super important because now the frontal plane is cutting the body at the head and we call it coronal. So this is why it has two names. The rest of the body as I go down, so from below the neck down, we call it the frontal plane, but the same exact plane cut here at the head, we call it coronal because it seems like if you put a crown on somebody's head, it literally cuts the crown, the head, in a front half and a back half, or ventral and basically a posterior, anterior, posterior, or ventral and dorsal. All right, so anterior in the front, posterior in the back. Synonym for it, ventral and dorsal. Anterior, the other terminology for it, anterior, posterior. Okay, so this movement is side to side movement. So if I'm a little bobblehead like this, when I take my left ear to the left shoulder, bring it back, take my right ear to the right shoulder, bring it back. This is coronal plane movement at the head. But if I'm doing side stretches, okay, let's say I'm stretching to the left and to the right side, okay, I'm doing movement in that frontal plane. If I'm moving the head, it's movement in the coronal plane. Either way, it's the same exact plane, two different names for the same plane. And don't forget the movement, and don't forget the terminology behind it, because remember, mid-sagittal, it was easy. All we had was medial and lateral, but with the frontal, we have two terms. We have dorsal in the back and ventral in the front, right? Or in the front, anterior, and in the back, posterior. Either way, you can use either terminology. Now, finally, I'm going to clear out these annotations and get to the third term, And this is called the transverse plane. So if I cut the body across like this, and literally if I cut the body at the trunk, there's a superior portion above the trunk and an inferior portion below the trunk. Everything above the trunk is towards the head, so we call that cephalad, and everything below the trunk is caudal, or towards the tail. So therefore, transverse plane movement is unique because just remember, when you say no, right? This is transverse plane movement, right? Here's the transverse plane, and I'm moving my head in the transverse plane. Or if I'm doing spinal twisting, okay, that is movement in the transverse plane. All right, so hopefully that is super clear. Planes of movement are useful for analyzing and describing movement, but real life movement doesn't happen in a single cardinal plane. So remember, when you throw a ball, or when you're doing, I don't know, a gymnastics tumbling move, you're moving in three-dimensional space. Therefore, your body moves and your limbs move in three planes as well. So if I'm rotating my shoulder, this is triplanar movement at the shoulder joint. Okay, I'm moving in the sagittal, in the frontal, and the transverse plane. Now, certain joints will not move in all three planes. For example, my elbow can only move, and excuse my hyperextension. This is me and my hyper flexibility here. So this is full extension should be 180. This is hyperextension, and this is flexion. All right, this is only movement in the sagittal plane. As you can see, my elbow doesn't go in three planes. If it would, I would look like a little puppet. All right, so certain joints move in three planes, other joints move in two planes. The knee only moves in two planes. The hip and the shoulder joint moves in three planes. And when we move into joint movement, you'll get that lecture in way more detail. All right, so now, the terminology, as I said, the terms used to describe the location and the movement is based on the three planes. So anterior, posterior is going to be what? It's going to be what plane? Anybody? Well, I will tell you because nobody's out there. So anterior, posterior is going to be movement in the frontal plane, right? Anterior, everything in front. Posterior, everything in the back. Same thing, ventral, dorsal. Both of these terms refer to frontal plane as a reference point. Okay, don't forget that, super important. Now, the other one that we went over was medial and lateral. And remember, that was literally the first term that we went over, the first plane. So what was the first plane we went over? Well, it wasn't frontal, it was mid-sagittal. So remember what I said, let's practice. The ear is lateral in reference to the eye, but the eye is medial in reference to the ear. Why? Because the mid-sagittal plane defines the most medial aspect of the body, cut in equal half right and left. So my right eye is lateral to my nose because my nose is most medial. But my right eye, in reference to the ear, is actually medial. So my right eye is medial to my right ear. But my right ear is lateral to my right eye, and my right eye is lateral to my nose, and most medial is my nose. Okay, hope you kept up with me on that. So this one is a mid-sagittal or sagittal. All right, most of us know that when we're talking about sagittal, we're referring to the mid-sagittal plane. All right, so we have three planes. We're three-dimensional beings. We did frontal plane, we did mid-sagittal plane, and now we have inferior and superior. So everything above a transverse plane is superior. Everything below a transverse plane is inferior. And now, finally, I'm going to go over a couple more terms proximal and distal. This is the one that everyone confuses. So this is why I saved the best for last. So proximal, the definition is that it's nearest the trunk or point of origin. So here's where people get confused, because in surgery, we don't always refer to the trunk. If I'm doing foot surgery, I'm referring to the point of origin. So if I start my incision proximally, that's my point of origin, and I work my way distally towards the distal phalanx, then that is the end of my origin and end of my incision. And so I could make a straight vertical incision, which goes from proximal to distal, or I can make an oblique incision, which goes from proximal lateral to distal medial, or start medially towards the midline, right, towards the mid-sagittal, proximal medial, and work my way distal lateral. All right, so what do I mean by that? Let's say I'm going to try to draw a foot. All right, so let's say normally when I used to do bunionectomies, it was, easy, straight, vertical like this, okay? And if I did my operative report, I would start and describe that, if I'm here at the head, right, I would start proximal and end up distal, and say that it would be a 3 centimeter incision ending at the base of distal phalanx, let's say, okay? Now, let's pretend that I'm going to do something else. Let's say we've got an ankle and here's a foot. Now, listen, this is why I went into science. I'm not an artist. 1, 2, 3, 4, 5, but I am going to try to draw out 5 toes. And there's the heel. So here's the ankle. So let's say we have a ganglion cyst, and I'm going to describe the incision because it kind of cuts across, and it looks like it's going to involve more than one tendon. Maybe there's 2 ganglion cysts. I don't know. I'm pretending. I've never seen 2. It's always 1. But anyway, let's say we're just going to make a fictitious procedure here. So where did I start? Point of origin was here, number 1. Here's where it ends. So remember that if this is the hallux or the big toe, this would be the mid-sagittal plane. So I'm going to describe the incision as 4 centimeters starting proximal medial, that's the point of origin, going 5 centimeters distally, ending distal lateral, near, like, let's say that, make a point of reference in terms of the anatomical area near the cuboid bone. Okay, which of course you're going to learn later as we go through anatomy. So that's an example of understanding proximal versus distal. So the other way I tell people is distal means distance, far distance, or far away from the midline or center of the body, and far away from the point of origin. Proximal is going to be nearest the trunk or nearest the point of origin. Now, the easiest one is ipsilateral. If I lift my right arm and right leg, this is ipsilateral movement. All right, right arm, right leg, lift it up. Okay, can't do that on Zoom very easy. That's ipsilateral. And then contralateral, if I lift my right hand but my left foot, that's a test of my coordination. All right, contralateral is the opposite side, ipsilateral, same side. All right, and then transverse plane cuts across the body. And as you know, everything above the transverse plane is going to be superior. Everything below the transverse plane is going to be inferior. And I also described earlier in the other page, caudal means towards the tail. So that would refer also to the analogy. It's the same, it's synonymous with inferior, right? So caudal or inferior towards the tail, and then towards the head is cephalad. This is how you spell it, CEPHA, cephalad, okay? Cephalad, and it's towards the head, or otherwise known as superior and or That's pretty much the terminology that you can use. All right, so I hope that was helpful. Other terminology that I'm going to talk about as we move through this session. We talked about flexion is decreasing the angle of a joint. So if I'm flexing at the elbow, I'm now at 90 degrees. And then extension to 180 is the full extension, increasing the inner angle of the joint. And then hyperextension, which is what I have, it's called EDS or Ehlers-Danlos hypermobility. It is something that you're born with, and it's your special power collagen. I'm just going to call it a special power, but really it's not good for the joints. So anyway, so that is a flexion extension. Now, abduction, adduction. So let's do that. So abduction, adduction. Some of you that have discussion boards on this, especially if you're one of my students at Herzing University, our first discussion board, you have to talk about a term. So adduction, abduction. So abduction is moving the limb away from the body. Adduction, or adding it back towards the body. Think of it as if someone gets abducted, they get taken away from the home or whatever, the street, right? So abduction. And then bringing the limb back towards the mid-sagittal body is adduction. Okay, so lifting the leg to the side, lifting the arms up into a T position is abduction. And then adduction is bringing the limb back, okay? And even crossing one leg in front of the other is considered adduction. And crossing the arm in front of the torso or behind the back is also adduction. And so if you're doing a discussion board on abduction and adduction, you can choose to talk about specific pathology that causes one to lose abduction, the movement of abduction, maybe perhaps due to nerve damage, etc. So always think of these anatomical terms in terms of using it clinically, because most of you are going to use this terminology and not just say, okay, I memorized this and I'm done. No, this is foundational learning and a foundation of everything you will ever need to know in the medical field, in the sports sciences field, whatever you're going to be doing, you need to know your anatomy. It's kind of like knowing math if you're going to be an engineer. Okay, so the next thing is lateral flexion. So this is, as I showed you earlier, side bending of the neck or the torso, dropping the ear to one shoulder, coming back, dropping the ear to the other shoulder, coming back. And I like to incorporate my background not just as a podiatrist, not just as your anatomy instructor, but also the fact that I've been teaching yoga and more recently Pilates, and I've been in the exercise industry since 2008 is when I got my certification in yoga. But moreover, I was a elite level gymnast and really understand the body and its movement. So sports science is my other passion in just not even applying it, but understanding it and teaching it to other people and making them apply it. So with that said, there are yoga poses that we do, like the crescent stretch. There are movements when we do, for example, sun salutations, you could do a lateral crescent stretch. So there are many applications of movement where you're stretching the obliques and the intercostal muscles, all because you're doing lateral flexion. Now, rotation. So rotation is pivoting around a long axis. So rotation could be a seated spinal twist when you're doing yoga seated spinal twist. You can be doing the turning the palms up and down. What was the palms up? Soups up, hands are supinated. Palms down, hands are pronated. So circumduction is rotation of your hands, but it really comes all the way to the arm, right? Dorsiflexion of the foot, plantar flexion of the foot is sagittal plane movement. So if I'm moving my foot up and down, all right, dorsiflexion, extension, it's all due to the ankle movement. It's not really the foot. The foot can only move because there's the ankle joint so that the tibia is kind of rolling over that talar dome, the talus bone beneath it. So pointing the toes, or in ballet, ballerinas and gymnasts point their toes. That's called plantar flexion. And again, rotating the forearm forward with the palm turned up is supination. And then rotating the arm downwards, that's the palm down. And so the palm is turning inward towards that mid-sagittal, right? That means that that's pronation, all right? Inversion is turning the foot medially towards the mid-sagittal. Eversion is turning the foot away from the mid-sagittal. And that movement is specific to one joint called the subtalar joint, where you have the talus bone sitting on top of the calcaneus or heel bone. And above the talus bone, you have that tibia, which obviously the tibia and the talus is your ankle joint. But the actual movement is below the ankle joint. Inversion, eversion is the movement between the talus and the calcaneus. Thus, we call that the subtalar joint movement, inversion and eversion. Now, abduction and adduction, I beat that to death. Hopefully you understand what abduction and adduction means now. Moving the arm away from the body, moving the arm back towards the body, moving the lower extremity away from the body, moving the lower extremity back towards the body. Now, one thing we didn't go over is protraction and retraction. So drawing the shoulders forward, which we see a lot of people rounding their back, shoulders forward, just kind of, you know, slouching, that's protraction. Retraction is someone who works out and has strong lats and strong rhomboids. And so they got good posture, shoulders are down away from the ears, chest is open, as I always describe in my yoga classes. All right, drawing the shoulders back and squeezing the scapulae together or shoulder blades, all right? And in between, you're activating the rhomboids, which of course you'll learn about the rhomboids as we move through anatomy. All right, so circling back to review, we have the three planes. By the head, we call it coronal, but by the whole body distally, it's the frontal plane, which divides the body in a front and a back. In the front, we have ventral. In the back, we have dorsal. The same synonymous term can be used, but it could be used as, besides ventral dorsal, we could use anterior posterior to describe the same thing, which is anything that is in front of this frontal or coronal plane, like your nose, face, whatever, breast, blah, blah, blah. All that is ventral, okay? Or anterior, and then behind this coronal and frontal plane is dorsal or posterior, okay? Then you have the mid-sagittal plane cutting the body in an equal left and right half. So the breast here is medial to the shoulder joint, right? And the shoulder joint is lateral to the breast. However, the breast is lateral to the sternum, right? Because the sternum is most medial, it's literally along the mid-sagittal plane. And then finally, we have the transverse plane, and everything above it is superior, everything below it is inferior, and twisting is movement in the transverse plane, and saying no at the neck, like let's say we cut the body at the neck, transverse cut, moving the head this way is movement in the transverse plane. All right, so these are the terms. I'm not going to beat this down even more because I already went over it. And just make sure you understand the terms of position, the terms of movement in the sagittal plane, frontal plane, transverse plane. And always remember that transverse, you could use this analogy, T for top view. Frontal is the front view and sagittal is the side view, if that helps you any. All right, proximal is toward the trunk or near the origin. Distal is away from the trunk or far from the origin. Distal equals distant. Proximal equals proximity, so that's one way to remember it. And then don't forget, the midline is the mid-sagittal plane. Everything towards the midline or mid-sagittal is medial. Everything going away from the mid-sagittal plane is lateral. And don't forget, the reference point is the trunk or point of origin, right? So proximal or distal from the trunk, so everything far away from the trunk is distal. Everything closer to the trunk is proximal. All right, so make sure that medial versus lateral, superior versus inferior, anterior versus posterior, proximal versus distal. And then finally, if you're in my Herzing University class, you have a discussion board where you can actually use the term and describe superficial versus deep. So you're gonna have to understand the layers of the skin, the top layer, the middle layer, and the hypodermis. So epidermis, dermis, and hypodermis. So a superficial incision is only going to be through the epidermis. A more deep incision is going through the dermis and down to the hypodermis, where there's fatty tissue and a vein, artery, nerve flowing in there somewhere. So I like to call it fat in a van. What's VAN stand for? Well, vein, artery, and nerve, because they're hiding in there, and so it's complicated when you're moving through that tissue. All right, so there it is. So, and then finally, don't forget, unilateral is on one side, bilateral is both sides. So, for example, if I had surgery on one side, that would be unilateral surgery, which I initially had a right hip replacement, and then the following year had a left hip replacement. So now I'm a bilateral hip replacement patient. Okay, so that's an example. Ipsilateral is if I have, God forbid, but let's say someone has ipsilateral effect pathology from a cerebrovascular accident, aka stroke, or if someone has contralateral issues like opposite ends, right? Lifting my right hand or left hand versus right leg, left hand. So right hand, left leg, that's contralateral. All right, here it is again. When you move the body forward, that's flexion, extension, and then hyperextension. So this is movement in, this is a pose, it's a yoga pose, but let's say she's moving. This is movement in the sagittal plane. This is the pyramid pose, movement again in the sagittal plane. Now, this is sagittal plane. This is transverse because she's moving and twisting from the torso. This is coronal because we are doing a pose in that coronal or frontal plane. Sagittal plane because you're flexing, coronal because you have a front half and a back half of the body, and you're holding that pose in the frontal plane. This movement, again, is in that frontal or coronal plane. All right, this movement is, again, you're holding the pose in the frontal plane, but if you're twisting, now we've got what? Now we've got transverse plane. We're holding the pose in frontal plane, but twisting in the transverse plane. And this one, we are holding the pose in frontal plane, but we're moving into that flexion of the hip. So this is sagittal plane movement. Okay, and this is lateral flexion extension, but the position, goddess pose, is in the frontal plane. So you see how the body is not static, and this is why when we use these terms, we have to be very careful and analyze the movement if you're going to be in the kinesiology studies, moving towards more like physical therapy assistant program, physical therapy, yoga therapy, Pilates, etc. All right, so here we're moving the trunk, all right? So we're twisting in the transverse plane. And the pose itself is, however, chair with a twist, and it is in the sagittal plane. Tree pose is in the frontal plane. As you can see, if I was to draw a box around her, there's the front aspect of the body that's activated holding the pose, and then there's the back aspect of the body activating and holding the pose. So we can say ventral dorsal or anterior posterior, we're holding tree pose. Okay, so what anatomical plane is this? This is anatomical position with the hands supinated, and we call this Tadasana in yoga. And the plane that we are looking at is frontal plane. All right, so here's movements. I'm going to probably reserve this for another lecture because otherwise I'm going to be here forever when we do joints. So I'm going to stop sharing now. And I hope you enjoyed this lecture. And if you have any questions whatsoever, please do not hesitate to reach out to me. Bye.